Okay, we're going to try this one more time. We did this, I did the whole thing at 12 o'clock, and my phone kept saying, you're having connection issues, you've got low resonance, keep trying. And so nobody ever said hi. So I know this is not the time that you normally see me at 2:30 on a Friday afternoon, but I did take one at noon. And so this is going to be take two, because take one it's out there. Don't know where it is, but it's out there. But you're not going to be able to find it because I can't find it. Okay, so we're going to do this again. I am your host, Dr. Polly Heil-Mealey with Abundant Health and Wellness, and we are located in downtown Humble at Main Street and Avenue C. Now today I still want to talk about the emotional connection of fear and anxiety to chronic pain. And so this is an article that I read. I've got a couple of books on it that I have read. I have talked to other like-minded professionals. So there's just a lot going on with this. And I want to share this with you because so many people suffer from chronic pain. And so this is something that hits a little bit close to home because we've got family members that are having some pain issues. I myself have had some challenges this year, and so I've been learning this firsthand. But I want to read this article to you or talk to you about this article and chronic pain so that maybe we can avoid the statistics and be pain-free. Okay, so that's what I want us to do. So this is a story about a man. His name is Ozanich. That's his last name, Stephen Ozanich. When he was about 14 years old, his back locked up, and for the next 30 years he was in chronic pain, and nothing stopped the pain. He says, I was desperate. I tried acupuncture, thousands of chiropractic manipulations, physical therapy, hanging upside down like a bat, and I'm trying to stretch it out. Finally, he resigned himself to surgery, which included a spinal fusion and titanium plates. A couple of weeks before the procedure was scheduled, however, he ran into Dr. John Sarno, S-A-R-N-O, who was a professor at rehabilitation medicine at the New York University School of Medicine. Thanks to Sarno, Ozanich canceled his surgery, and 17 years later, he is still pain-free. And that's really, really what we want, okay? So, starting in the 1990s, prescription opioids became increasingly popular among doctors tasked with treating chronic pain. But the result was what? An epidemic of addiction, okay? When the medical establishment realized what was going on, they had to deny their patients this medication. So what did the patients do? They turned to heroin or other street drugs in order to get off or get out of the chronic pain. Since 1999, the number of opioid deaths from both prescription and illegal drugs has quadrupled, okay? According to the Center for Disease Control, 91 people overdose on opioids today, okay, every day. So this is a lot of people that are having problems. Now, you know, here in the clinic, we don't do prescription drugs, okay? We do all holistic, but we do have people that come in who are addicted to opioids because they are in chronic pain. So chronic pain is something that I've been researching for a long time because, number one, I don't want to be in it, but I also don't want you to be in it. And if I can figure out what to do about it, then I'm going to be able to help you, right? So that's what we want to do. So, this Dr. Sarno, okay, remember he's from the New York Medical University. He said, from his perspective, pain isn't rooted in the physical, but rather in the mental and emotional. He calls the process tension myoneural syndrome. So he abbreviates it TMS. So tension is what you have when you have anxiety, right? A lot of stress. Myoneural means muscle and nerve syndrome. So he says the idea that our dark, unexpressed feelings cause chronic tension resulting in physical pain. So Sarno hit on this idea in the 1970s when examining a woman he called Helen, who was bedridden due to severe pain. Under psychoanalysis, Helen recalled being molested by her father. Uncovering these memories culminated in an emotional meltdown. Well, yeah, I guess so. And a feeling that she was going to die. But after sobbing for several minutes, she felt that the pain she had been carrying for so many years suddenly disappear. Okay? Observations like this convinced Sarno to see chronic pain as a kind of protective mechanism, a distraction from feelings you're not ready to face. Now, let me just say this right now. I'm not saying that everybody with chronic pain has been molested. That's not what this is saying. What this is saying is the body, we are a mind, we are emotions, we are physical, a body, and we have a spirit. So that's 4 components to us as a human. When we are traumatized emotionally, say molested by your father, that would be something, even as I say those words, for me to know my father would have done that to me, I would not be able, it would cause a break in my psyche. I would not be able to handle it. My dad did not molest me, so don't anybody, that's not what I'm saying. I'm just saying, looking at the situation, that would be an emotional, physical trauma that I would not want to deal with on a conscious level. Because it would be too painful to realize that my dad is a creep, then I would stuff that. I would stuff the pain. I would stuff the memory. And it would not be in my conscious mind, but it would be in my subconscious mind. And the body would respond with pain as a distraction. So I would be consciously focusing on the pain rather than focusing on the emotional trauma. I hope that makes sense. The body is like that. The brain is like that. Depending on your personality, everybody's different, and there's no right or wrong personality, all right? You are who you are. I'm a Christian. I believe that we should have a Holy Ghost temperament, okay? And what that means is that we're mindful, we know how we're supposed to act, we invite the Holy Spirit to help us to be mature and act like Christ act and all that kind of stuff. I'm not sure what your philosophy is, but you've got a philosophy, okay? But even so, whenever anything upsets me or frustrates me, I am a stuffer. And I learned to be a stuffer, I guess, from my mom, because my mom never showed any emotion. And so my personality is I won't deal with it. I'm a non-confrontationalist. And because I know that it's not godly to be angry, I know it's not godly to be mad, I'll just stuff those emotions, move over them, move forward, don't pay any attention to them, okay? But my subconscious mind knows that they're there. It knows that it's too hard for me to deal with, and so I will deal with it in my physical body. That's what he's saying. No matter what kind of personality you have, if you do not deal, and as we go on with this, the emotions that they're specifically talking about with chronic pain is anger and anxiety. Now, as believers, we know that we're not supposed to be angry, and we know we're not supposed to get into anxiety. But guess what? There are times when that happens, and if we do not deal with that appropriately and process completely, then we're going to stuff those emotions, and it is going to come out in a different way. So we're going to get a little bit more in depth in that in a few minutes, okay? It says, observations like this, okay, we said that, Sarno, to see this as a protective mechanism, a distraction. For those willing to confront the emotional demons that lurk behind their pain, the process is a revelation. And a 2016 documentary about Sarno called All the Rage, okay, Larry David confessed to weeping after his appointment. All of a sudden, he said, this is the closest thing I've ever had in my life to a religious experience, and his pain disappeared. So that's a big deal, okay? Medical science is focused on the body, okay, as a whole when it is looking at physical. Ancient traditions, like traditional Chinese medicine, okay, believes that negative emotions injure the organs. So Fear hurts the kidneys, anger hurts the liver, and grief hurts the lungs. And so we know that. We absolutely understand that happens. I want to tell you a quick story. I didn't say this in version 1, but I'm going to tell you this because I just feel led to do this. When I was pregnant with my daughter, now my daughter is my second child, and I had a perfect pregnancy the first time I had a child, very easy birth, perfect child, APGAR score of a 10. So you can't get any better than that, right? He's absolutely an overachiever. When I got pregnant the second time, I had some anxiety that was I didn't know where it came from. I knew enough not to express it because I know that what you say is a magnet to what you want to draw to you. And so I didn't say anything about it, but I was very, very anxious during my pregnancy that I was going to have problems with the pregnancy, that there was going to be something wrong with the baby. I was just very, very fearful, very, very anxious. I had prayer for it, all kinds of things. I mean, it was just crazy. So I had the baby was fine, everything was fine. When she got to be, and people that know her know this, so I don't think I'm telling anything out of school, but when she got to middle school age, she developed overactive bladder. Went that way through middle school, went that way through high school, and we would take her to the doctor, we would get cultures, we would get things checked out, and we didn't know why, nobody could see why, but this young woman had this bladder issue. And so here I am, older, and I am back in school, and I'm learning all about this health stuff, and I am in a class, and they're talking about how emotions damage the physical organs, which I had never heard before. And they were talking about fear and the kidneys, and I got the realization and the revelation that her bladder control problem was a direct result of the fear that I carried all the time that I had her. Now, you're going to say, Dr. Paula, you're just crazy, you're just reaching for straws, but this is my story and I'm telling it. And I was very upset that I was the cause indirectly of this issue. And I came home and she was pregnant with her first child. And of course, you know, pregnant mommies, that your bladder is crazy anyway. So I sat down with her and I said, look, I learned this weekend, and I need to tell you, when I was carrying you, the whole time I was carrying you, I was very fearful, I was very anxious. And if you will forgive me, because I know as a Christian that being anxious and being fearful is a sin, because the Bible says so, right? And so I told my daughter, if you will forgive me for being anxious, this will go away. God will heal you. And sure enough, she just started crying. I was crying. And she says, Mom, of course I forgive you. You didn't know what you were doing. And in truth, I did not know. And from that moment on, even though she was pregnant, she has never had a bladder control problem. So just going to say that this stuff, I know from experience, that your emotions can damage your organs, but when you process those emotions appropriately, things just turn out the way they're supposed to turn out. So you can say I'm crazy, and that's okay. It's my story. It's my truth. And my daughter will tell you she's very grateful that we had this understanding of what causes kidney and bladder issues, because she has a much more full life, not having to worry about where the next bathroom is. So anyway, that's my story. I'm telling it. So here we go down here. Let me turn to this page, because I want to get a lot of things in here to help you on this. So a man named Handsome argues that chronic anxiety and anger are the root of all chronic pain cases, or nearly all chronic, it says. He explains it as an issue of body chemistry. He says, with prolonged anger or anxiety, the body excretes adrenaline, which has been shown to make nerves more sensitive. So your bone spurs, tendinitis, herniated discs, or other physical anomaly that previously didn't bother you suddenly becomes annoyingly uncomfortable. So this is what he's saying when these emotions are not dealt with appropriately and discharged appropriately. If they are hidden, if they are squashed, if they are suppressed in any way, the body can't handle it, and it's going to come out in a physical manifestation. Now, This is a book that I have, and I highly recommend it. It's called Feelings Buried Alive Never Die. And in this book, it has, let me see if I can find it. Maybe I can find it. They've got a whole section that is dedicated to possible feelings that cause illness. So if you're dealing with an abscess, what feelings that could be. If you have Addison's disease, what feelings that will be. And we have used this book here in the clinic. I've used this book myself. It's got all kinds of tools in there to help you process and deal with your emotions. And it's very, very good. There's another book called A More Excellent Way by Dr. Henry Wright, W-R-I-G-H-T. He just passed away this past December or November, right around Christmas time. And he says that every sickness and every disease has an emotional component. And he gives you all of that in that particular book, what emotion causes what manifestation. And so what we want to do is we want to stay healthy. We want to age well. We want to be able to press through emotional trauma, and we all have it. My husband died when I was 42. It was absolutely traumatic. My mother went through cancer treatment, radiation, and chemotherapy. It was absolutely devastating for us as a family. It was I had a lot of anxiety about it. I had a lot of anger about it. And I will just tell you, this is a funny story, right? But I've been in menopause now for quite a while. And I was in menopause for probably 10 years and never really had any symptoms whatsoever. When my mother was over-radiated by the hospital, it really tore me up. It tore me. I thought I was going to have a nervous breakdown. I was very angry, all those kind of things. And I tried to deal with it appropriately, but it's a visceral feeling. And do you know that out of 40 menopausal symptoms that I had never had going through menopause, because of that anger and that anxiety, I had like 20 of those symptoms overnight. And I know it was all because of the anger and the anxiety. And it was real. It was something that I had to deal with. It was something that I had to process. And everything is okay now. My mom is great. She's very healthy. But still, all of us, I'm saying, all of us have opportunities in life to be angry, to be anxious, to be fearful, to be mad, to be frustrated, to be disappointed, all those kind of things. And so when we do those kind of things, it sets us up for sickness and disease. This is a great tool. This is a, what is it called? It's called a toolkit, okay? It's called Self-Reclaimed, and the subtitle is You Feel the Way You Think. So think about that. If you're sick all the time, if you hurt all the time, if your body's not working right, it's because of the way you think. And so this book helps you to address and identify limiting beliefs that are not true, lie-based thinking. If you have those kind of things in your life, you're going to be sick. So this is another tool we have here in the clinic. You can order it off Amazon. You're going to pay a whole lot more than if you order it from me, but I'm just saying, this is a tool that we have as well. We also have real live people that will help you. I have a colleague who her specialty is pain management, and she is an hypnotist. Now, before you guys go all weird on me because you don't know what hypnosis is, hypnosis gets into the subconscious. It's not mind control. Forget about what you've seen on variety shows. Forget about all that. That's not what I'm talking about. I'm talking about bypassing your logical mind and getting into the subconscious where all the magic happens, okay? And so the Bible says that the heart of man is deceitfully wicked above all things. Who can know it? And why is that? Because we deceive ourselves, okay? We don't want to, as this woman who was molested, she did not want to deal with that. She did not want to have to address that. So she suppressed that, and it came out in a different way. we all have things we don't want to process or we don't understand how to process, so we stuff it for another day. And if we don't get back to it because we don't know how to get back to it, then it shows up in physical ailments, particularly pain. So Janet, her specialty is to help you bypass your logical thinking, get down where it needs to be so that you can be set free. So I'm going to give you her contact information. We're going to post it here on the page, so you're going to have it in a permanent spot. She's in the Kingwood area, the Humboldt Kingwood area. So if you're in my area, you'll know that she's very, very accessible. She might be accessible via Skype or something. I don't know how all that works. But the name of the company is Janet Sizzler Hypnosis, okay? And her phone number is 713-446-8900. We're going to post that on the page so that you're going to be able to have that as a resource, okay? I just want to give you a few more things. It says low back pain is the #1 cause of disability worldwide. In the United States alone, okay, spinal surgery is a $12 billion market. But Ozanic says that even if surgery is successful, the person will still suffer from TMS. If you take away the symptom by an artificial means, such as surgery, drugs, manipulation, or whatever, the brain will not be denied. It will simply shift to a different symptom, he said. I have seen people who have TMS in their tooth. They get the tooth removed, okay? Then the TMS moves to another tooth. Like pain, addiction also can serve as a crutch to protect an individual from painful emotions. Osanich says, drinking and drugs can mask TMS for a while, but when the person finally becomes clean, the pain is likely to emerge to keep the dark feelings stuck in the shadows until the person is ready to face them. One of his clients, a reformed alcoholic who came to him complaining of stomach pain, had previously visited several physicians, but none of them could find a cause. Stomach pain emerged within 24 hours of when he stopped drinking. Arsanich explained that it was merely another diversion of the brain to fill the void once the alcohol was gone. We took away the diversions, and all he had left was raw emotion that was the bottom of all of his problems. He fought through that. He's fine now, and he has actually opened an addiction clinic. So this is the thing. We all have emotions. We all have negative emotions. I want you to do whatever it takes so that you can get well. Today, I don't believe in coincidences. I believe in divine appointments. And today, this morning, we had a young man come in the office, and he was in a walker, and he was actually sitting in it. And he was asking me about pain. He wanted something for pain. He just had this chronic pain from a hip replacement. And I asked him how long the hip replacement had been. He said it was over a year ago, and the pain was no better. And I said, is there any infection? Is there any this? Is there any that? He said, no. He said, nobody can find out what it is, and none of the drugs the doctors give me do any good at all. And I thought, wow, here I was just reading about that very thing. And I explained to him about emotions and anger and resentment and anxiety. And he just kind of looked at me like I was crazy. But you know what? If nothing else is working, then something else is going to work. So you have to have an open mind. You have to think about what you've done. I'm very definitely a believer in feelings buried alive, never die. And I really, just as a human being, I go through this book and I look at all of the emotions and I pray through these emotions. Why? Because I don't want to be stuck, right? I don't want you to be stuck. So if chronic pain is something that you're dealing with or someone you know is dealing with, get the book, call Janet, get the toolkit, self-reclaimed. All of that will help you process and get past the conscious mind down into the subconscious where these feelings still live and they're causing you pain. We don't want you to be in pain. You don't have to be in pain. And so hopefully you found this very interesting. Do your own research. Don't just kind of think, oh, well, as a Christian, I can't do hypnosis, because I've heard people say that. I've even been told that. But you know what? Back in the day when Gutenberg had his printing press and he was doing a whole page all at one time, and he didn't wait on, scribes writing it out a letter at a time, people said that the printing press was demonic. Now, we laugh, but back in the 1700s, it was not a laughing matter. People were being burned at the stake and all that kind of stuff. So what we don't know, we kind of demonize. Let's not be that way. Let's be open-minded. Now, of course, you need to have common sense, and you want to find a practitioner that believes the same way you do. And I believe that for any energy medicine, whether it's a chiropractor, craniosacral therapist, massage therapist, reflexologist, hypnotist, whoever, right? You want to have somebody that has the same belief system that you do, because you want to have that same understanding about the way the universe works. But if you are in chronic pain and drugs are not helping, herbs are not helping, supplements are not helping, then you're going to have to open it up that it might be your emotions. So prayer might work for you, meditation might work for you. There are all kinds of tools out there. Janet is another tool. She's beautiful, she's lovely, and her specialty is pain management. So I encourage you, if that speaks to you, that you seek her out, and we'll put all this on the page. Thank you guys for coming back at this late hour. I appreciate it. And I apologize for the technical difficulties that we had earlier. I have no idea what happened. It didn't stick in there. So have a good weekend. Be good to yourself. We're supposed to have a lot of rain tonight in East Texas, in the Houston area. So be good to yourself. Stay safe, and I'll see you next week. Take care. Bye-bye.